Hi, my name is Dr. Jason with Carolina Value Pet Care. Today, I'd like to talk to you a little bit about two very popular medications that we like to use for dogs with allergies, especially allergies that are causing a lot of itchiness to the point that they're getting really uncomfortable. The two medications are called apoquel and cytopoint. Apoquel is an oral medication. Cytopoint is an injection that we give under the skin, and they work a little bit differently. So I just want to go over a little bit on how they work to help our dogs out. So we think about apoquel. It's a pill we take. If it's the first time they're taking it and they're having this bad flare up, a lot of times I'll do it twice a day, and I'll do that for 2 weeks to get things under control. After taking the pill, even within 3 to 4 hours, it's already starting to decrease the amount of itchiness and decrease the inflammation in the skin. The way it does this is the body has tons and tons of different messengers, right? That if something happens, I need a messenger to go from kind of cell to cell to cell to tell my whole body what's going on. Well, there's a certain messenger enzyme that apoquel actually blocks. And the one that it's blocking is the enzyme that actually goes up to tell the brain to say, hey, there's a lot of itchiness going on. There's a lot of inflammation going on. Well, I can actually turn down that enzyme with giving this medication. So our brain doesn't realize it's so itchy and doesn't realize all that inflammation is going on. So our dogs with allergies that are constantly and chronically just feeling like they can't stop itching, it can control some of that itchiness and can control some of the inflammation in the skin. So it works really well that way. Uh, some dogs need to be on it just for short courses when they're having a bad flare up. But I do have other patients that are on it all year round that they may have some seasonal allergies, but it may be a different allergy each season. So maybe it's your grasses and stuff during the spring and summer, but then we can even see like dust mites and molds and stuff too that get higher amounts in your homes during the wintertime, and they're also allergic to that. So some of them will be on it year round. Some of them will just be on it during kind of flare ups in the spring and the fall. It really just depends what your pet needs for how long we're going to prescribe this medication for. So that's apoquel. It's easy. It's good to give as just orally, like I said, twice a day to start with, and then a once a day. Sometimes I'll even back it down to like 3 times a week or something, or every other day if they're doing pretty well on it. Another medication we got is called cytopoint. Cytopoint is an injection, so especially if you have a dog that you know you're not going to be able to medicate or get a pill down them every day, then cytopoint's a great option for you. So it's one that we have to do at the vet clinic, so you can come to us and we can do this injection. Starts working within about 1 to 3 days after giving the shot. It starts helping them out. Works a little bit differently than the apoquel does. Instead of inhibiting or slowing down one of these enzymes, cytopoint's actually an antibody that goes in under the skin. This antibody then binds to one of those messengers, and when it binds to it, it makes it so that messenger can't get it up to the brain to tell the brain that we're super itchy. So it's pretty cool. It just binds to it. And then once it binds to it, it really just makes that itchiness factor not work anymore. So it can do that. And the fun part about this too is that it lasts for a while. It's not this daily type of medication like apoquel. Most patients I see about 4 to 6 weeks or so before they start feeling itchy again, where I have to give them another shot. But I do have some that even go out like 2 months or so before they feel itchy. So if your dog is one of these ones that only needs kind of has a flare up in the spring and the fall, maybe it just needs like that one shot or maybe a second one to get them through that bad grass pollen season. And that might be all they need. But I do have some other patients, though, that do have some allergies all year round that we wind up giving it every month, kind of 12 different doses throughout the year. So those are our two major medications that we'll use. They're safe for long-term use, which is nice, safer than some of our previous options, which was typically steroids. Steroids do work to help itchiness. They do help with inflammation, but given long-term, day after day, month after month, makes you at a higher risk for skin infections, higher risk of urinary tract infections, higher risk for a condition called Cushing's, another disease, diabetes that I'm sure you've heard of before, makes them higher risk of that, even higher risk if they're prone for any type of heart disease. It might make that worse too. So I may do a one dose sometimes of a steroid, right? But if it's a chronic allergy that I got to manage for a long time, then apoquel or cytopoint is going to be a much better option for you. All right. If you have any other questions or you're interested in starting one of these medications, take a look at our website, carolinavaluepetcare.com. See when our next clinic is going to be. Come on in and just let the person when you're checking in know that you would like to speak with the veterinarian today and have a skin consult. And during that consult time, we can talk about these options and figure out what's going to be best for your pet. All right. Thank you, everybody.